Welcome to Captives Over Cocktails, the only place where we serve up complex funding strategies with a twist of lime and a splash of attitude.
We're your hosts. I'm Lydia.
And I'm Ashley. And we're here to break down the world of captives. No jargon, no fluff, just real talk about what's working, what's not, and what you actually need to know to win in this space.
So think of this as your insider happy hour. Whether you're a seasoned broker, a captive curious advisor, or just here for the vibes, we've got something for you.
So grab a drink, turn up the volume, and let's dive into the stories, strategies, and straight up truths that are reshaping the funding landscape.
This is Captives Over Cocktails. Cheers.
Hi, everyone, and welcome back to Captives Over Cocktails. I'm Ashley.
And I'm Lydia. Thank you for joining us.
Today, we are thrilled to have Kayla Shawn with us. Kayla is the CEO and president of the Healthcare Navigator, a data-driven platform helping employers and employees make sense of a very complicated healthcare system. Under Kayla's leadership, the Healthcare Navigator has grown into a comprehensive resource for simplifying benefits, saving people money, and making healthcare work better for everyone.
Kayla, we are so happy to have you. Thank you so much for joining.
Thank you guys for having me. I appreciate it.
So, Kayla, what drew you to lead the Healthcare Navigator, and how has your vision for the company evolved since you stepped into your role?
Yeah, so my first career was in hospice, and so it's very, it can be a scary first job, but it really did open my eyes to, one, the way that, healthcare has become corporatized, but also really how to care for people in their darkest moments. And I think I definitely found the best way to view healthcare, which is I am there for people when they don't know where else to go, and I am there to help them when they can't help themselves. And so I then went to the hospital side of things, so the corporate side of health systems, where I worked for a very large health system that was for profit. And essentially, I had climbed the corporate ladder, done all of the accomplishments, had all the CEOs in my back pocket, and I was like that corporate person everyone wants to be. And I was really good at my job. And then it wasn't until years go by and I started really drinking the Kool-Aid, as you will, with corporate, America. And I started seeing patients not as people, but as numbers, to be quite honest. That really started to shape the strategies that I would create for the health system that was essentially sucking money out of patients and making it even more difficult for them during their worst times. No one wants to say that, but that's the truth. And it wasn't until my grandma was actually affected that I really had a wake-up call. Seeing her in tears, seeing her in pain, seeing that I caused that pain, because that was the exact strategy that I presented and it got approved. All those accolades, all the, pat on the backs from the CEOs, it meant nothing seeing her at her lowest moment. And so I decided, okay, what are some ways that I can kind of figure out how to be a better person than this? Because I can use my talents for good, not just for evil. And so that's when I started figuring out, okay, what are some of the issues within healthcare? And it mainly boiled down to people not knowing the ins and outs of healthcare, right? Every doctor, every healthcare administrator, we know the ins and outs. We know what to ask and what to get and how to get it, but the average American doesn't. And so I, devised a plan to figure out how to bring that information to patients in an easy and accessible way. And so 3 years, we're 3 years in, and we are just has blown my mind the amount of traction that we've gotten and the popularity we have with the benefits world and with patients. And so that's really how we started.
It's an amazing story.
Yeah. So, kind of going off what you were saying, I think that employers and employees are often overwhelmed by just the complexity of healthcare. There's so many different parts and nuances. Being in the position that you are now, coming from your background, what gaps do you see most frequently, and how is the Healthcare Navigator addressing them?
I think there are tons of gaps. I would say first from the benefit space, there's a lot of confusion, right? Most Americans have no idea what step therapy is. They don't know what, let's say, the difference between a captive versus a fully insured. They don't understand that, you can essentially go to this, place for your imaging, but you can't go to that same imaging place 3 miles down the road because that's not in network. And so all of those nuances that essentially they're not necessarily common sense to the average person, it really does make it hard for them, because if you're confused about where to go and the system itself makes it, because let's all be honest, it does make it extremely hard to actually, navigate the system of benefits. A lot of employees will start, just either delaying care or just, saying, screw it, I'm going to go to this out of network place. Like, I just need help. Because that's really what they're at. Is like, I just need care at the end of the day.
Desperate.
And so I think that confusion gap is a huge, huge part of what a lot of people are dealing with and a lot of employers are dealing with, right? Because then that goes into higher cost claims and et cetera, et cetera. So I think the confusion part, but also the part about quality is a huge gap that I've noticed in benefits. And it's interesting because, again, I come from the more clinical side within health systems and hospice. And in that section, quality is king, right? But to the average patient, if you see a billboard on the highway, then for like a doctor that, has all these accolades, you're going to go to that doctor. You don't actually know if they're a good doctor or not. You just see the ads. And so from our side, though, we have those numbers to say, what their complication rates are, what their MIPS numbers are, all the things that on the other side we grade doctors on, but the average patient doesn't. And so I think that the quality side and the confusion side are huge gaps that really need to be addressed to get to the core of better benefits and also a better experience.
So true. We were just talking about before we were recording. I wish we'd kind of captured it, but my grandfather was just like your grandmother, kind of like put in a bad situation at the end of his life, and that confusion and quality at the same time, to not have someone to like advocate for you. We have a pretty big family, pretty like a lot of people who I would think could like do some great healthcare advocacy, but when it came down to it, like you're fighting a system that you can't. You're just too small. Like you need someone to like who knows who to call within the hospital, right? Like we were told that he would get better care for his condition down at Dartmouth Hitchcock, which is a leading medical center down here, but they didn't have a bed. And I was like,
Yeah.
okay, but like, so he's just going to suffer here?
Yeah.
And they're like, well, when they have a bed. And I'm like, that doesn't seem like a
Yeah.
great, like we're just sitting here suffering until then.
Yeah, I mean, no one tells you about like the busyness of hospitals and doctors. So we've heard like, oh, this doctor has a ton of patients, you might not be able to get in. Hospitals are the same way, and especially if you're in a more rural setting, that's gonna get even harder because most rural hospitals, their sizing is supposed to fit the population. So they can't fit everyone technically, not unless the population grows. And so they don't tell you that, but like they'll get you in the door so that they can bill you, right? But they won't tell you, oh yeah, by the way, this really important detail is something that you need to know. It's just one of those things where it's like they'd rather get you in the door rather than tell you up front. 'Cause no one's going to tell you up front unless you have like a navigation service. No one's going to tell you up front.
Yeah, of course, like that's liability on them, right? He actually checked
Yeah.
himself out at one point. It was like, I'm not sitting here for 3 days, so you can
Good
bill
for
about
him.
me just sitting here until a specialist can see me in 3 days. Like, and they were like,
Yeah.
that's against medical advice. And he was like, dying anyways. Like,
Yeah.
I'm gonna leave. Like, because what am I? I'm just gonna sit here and you're gonna do nothing for me. So yes, having
Yeah.
someone like that, I think it's so important. My mom was also like a single mom growing up and like navigating different types of insurance. Like she had insurance through her work, but it was like more expensive. So we were on state insurance. And like, I think that there's so many pitfalls, like not just hospital care, there's just so many nuances to healthcare that people need help for.
Yeah. Well, it's
What does
interesting
that
because
look like? Could you give us an example of like a kind of a navigation case study?
yeah, sure. We can go with the plan one, for example. So let's
Okay.
say I think this was about 2 weeks ago. So we had an employee come in. They were on Medicaid, and so it was a lower income worker, and so then they transitioned onto the employer's plan, which for all the brokers who are going to be watching this, that's actually going to be something that we may see with this new passing of the big beautiful bill is more people from Medicare actually switching on to their employer plans now that eligibility is shrinking. When you're dealing with low paid workers, a lot of the times the difference between Medicaid and private insurance is absolutely astronomical, right? With normally government insurance, things like step therapy aren't really enforced that much. Prior authorizations aren't enforced that much. Your deductibles are smaller, your out of pockets are smaller. And so, out of network is like not even a thing in, government insurance plans. And so when you switch over to the private space, that's where like those nuances come in. And so with our example, he switched over to the employer insurance and he didn't know, one, that his doctor that he'd been going to for years is out of network for that insurance plan. So he kept going, and our nurse navigators had to let him know, like, hey, by the way, this person that you've been seeing for years isn't in your network. And he trusted this person. He was also Spanish speaking, right? So it's not like there's also that thing of, this is someone that I know and I trust and I don't know where else to go. And so then it came into, okay, now you got to find a new doctor, and you've got to find not only a new doctor, but you also have to find a new, essentially, because his doctor was in a multi-specialty practice, meaning he had that doctor, but he also had, a cardiologist that he liked, and all of these other doctors. So he quite literally had to change his whole ecosystem of physicians that he worked with. And what comes with that, after we got him settled in there, unfortunately, he had to get a cystoscopy, which is a surgery, or it's more of like a surgery that helps them to understand what's going on within your body. And essentially with that one, he wanted to go to this hospital that again he'd been going to for years, but he didn't realize that that hospital actually had low quality ratings. So for example, like their infection rates were really, really high. And for anyone who doesn't know what an infection rate is, that's essentially your likelihood of getting an infection at that hospital based off of prior times of actually a patient getting an infection. And so not only was he going to a really low quality hospital, but also the procedure price was going to be astronomically higher compared to three others that was in his location. So that sort of thing, where helping them to understand it's not just about your plan, right? Who's in network, who's not. It's also about where you go for these big surgeries, because 9 times out of 10, there's going to be a huge, at the very least, $1,000 difference in procedure prices across your area, any area. I don't care where you are. And so, especially for those low paid workers, that means a lot, because some people can't afford a $10,000 out of pocket procedure. They just can't. And so, not only that, but like the quality wise as well. If you go to a really high infection rate hospital, your likelihood of getting an infection will add about $15,000 to $28,000 onto your original bill. So for both the employer and the employee, it's in like the best interest to use that navigation system, because like you said, you don't know those, you can't Google those things, and no one's going to tell you at the hospital those things. That's one of an instance where, we had to combine both that steerage for the insurance plan, but also the quality wise piece.
Yeah.
It's a great example. I think everyone just thinks every hospital is a great hospital because it's a hospital.
Yeah. And it's not.
Sorry, go ahead, Lydia.
No, I agree. And just having that awareness too, because just so many employees, so many people don't know. And so you bring that awareness and helping navigate. So special. But talking about that, as you're doing this day to day, what are some trends that you are watching closely, maybe over the next 2 to 3 years, that could really reshape how employers support their employees?
Yeah, I would say, everyone's done the buzzword of AI. You see it everywhere now. Everyone's got something to do with AI. And we definitely were on the forefront of that. So about 3 out of the 11 applications that we have so we have both an in-person service and an app. So normally the younger people, they love to use the app. The older people will just want to call a nurse. Either way, you'll get navigated. And with the app, we used AI a lot when it comes to things like medical bill negotiation or helping with clinical decision support. Like, for example, Ashley, people use Care Genius to figure out, okay, my doctor told me that, my mom can do these 3 procedures. Which one should I pick? And you don't know which one to pick. So it gives you the risks, it gives you an understanding of downtime, it gives you an understanding of price ranges, if she's going to be in pain or not, et cetera. And so those three things we use AI in our app for. And I think an interesting trend is that you got to be careful with the types of AI that you're dealing with, right? I think that
Yeah.
when AI was introduced, everyone just wanted to say that they did AI, right? But what I was really cognizant of is HIPAA, is the guardrails that you do need to protect the patient information. And so, like, for example, I see a lot of brokers using ChatGPT for like putting in like plan information. Make sure it's de-identified. Like, I know I had to tell so many of our brokers, like, slow down a bit, like, make sure one is, that ChatGPT is not HIPAA approved, right? And their eyes went
No, they
wide.
don't. They don't know
Yeah.
that.
And I'm like,
I'm going to do a
let's be honest.
shameless ClearPoint plug based on that,
Yeah.
because one thing that Jeb, our CEO, and I were talking about, I was like, if I was a broker trying to figure out the best funding mechanism for and I was a broker, so when I was, if this had existed, I probably also would have, and
Yeah.
brand new to the space, just plugged all the info in and been like, what's the trends? Where do you think they should go? ClearPoint has built a decision kind of making tool sort of like that, where we have ClearPoint Digital, where if you put the client's information in, HIPAA protected, we can
Yeah.
tell you what we think the risk is. If it's kind of red, yellow, green, what red flags are, and what funding mechanism we think it's right for. So we've taken that, because I agree, like, if I was a broker, why wouldn't you want kind of that decision-making support tool around funding mechanisms and risk? So I agree. But yeah, you have to be really careful. ChatGPT is not the end all be all. It's great,
Yeah,
but
it's not. And I think that's a great example. And I think, so, I mean, the one, just making sure that the bigger picture here is making sure that the vendors you're picking are, one, like, staying within the guidelines for HIPAA, because when there is a leak, oh my Lord, like, everyone guard your loins. Everyone needs to be protected. And so it's that first part of just making sure that the products that you use that are AI driven, make sure that they are abiding by the HIPAA guidelines, by the high tech guidelines. Like, make sure they're doing it by the book. I think another trend that we're really watching closely and that we're honestly built on is the consumeristic trend, right? So we're seeing a lot of people, they want healthcare like they have Amazon, right? That's exactly why we built the app, right? Because we knew, okay, in person, it's gonna die off pretty soon. My belief is that, now I believe the stat is about 74% of all Gen X, Gen Z, and millennials are using some sort of like smartphone based app or usage for any of their daily needs. So, like your Instacart or Amazon, whatever the case may be. And so, as we start transitioning, because we're already there, right? But soon it's going to get to that 90%, 100% of people who they want healthcare like they have Amazon or they have Instacart. And so that's really why we built the app, is because, okay, we know that, some of the older people like in person, let's keep it, but let's also make sure that we are going to be at the forefront of the future. And I think that's why we've seen such high usage of our app. Is, we have I believe it's a 79% engagement rate, which is like, I know it's like one of those things
that's
where
great.
it's a big eye turner, but it's really about, okay, what types of benefits do people want? They want a consumeristic benefit. I want to be able to quickly go to my phone, figure out what the price is for this procedure, which hospital I want to go to, what the quality is, and go. I don't want to talk to someone. I don't want to talk to someone. I want to keep it pushing. I have other things in my life to deal with.
Ease of
And
use.
so, yeah, exactly. People want fast and people want easy. And the healthcare system is extremely complex, which is why, admittedly, it was not easy to create an 11 in one solution like we have with the app. It's, most people only have about 4 solutions in one app. So to have 11 was just insane. It did take us a minute, but it really did. I mean, now we're reaping the benefits of it because, brokers don't have to go to several different vendors just to get, all 11 solutions. And so I think that consumeristic model is just going to reign supreme in benefits, and we're already seeing that with our success right now. So I would definitely tell people to watch that. And I think the third trend that I'm really seeing is really around the quality aspect. So before our app, most people and most employees, when we surveyed them, we asked, do you know, like, how do you know that this hospital that you go to is a good hospital or not? And they just said, I don't know. My grandma went to them when I was like, and she told me about them a few years ago. It's something like relational, but no one had any metrics, right? And so now we've shifted where we're seeing that 94% of the decisions made through our app, all of them are for the highest quality providers, highest quality hospitals, you name it. Everyone focuses first on quality, then on price. And I think the best trend in that, like a sub trend, if you will, is that a lot of people think if they're only going to high quality places, that means that it's going to be really high cost. And that's not the trend, right? What we see in the data is that actually the highest quality hospitals or providers, their prices are actually mid-tier. So they're not super, super cheap, but they're also not super, super expensive. And why is that? Well, when I worked in the hospital, we knew that people knew, like the paramedics for example, they take a look at your quality metrics. So with them, they knew that we had really good quality metrics, so they would send people to us more, so we don't have to like hike up our prices. We don't have to do that because we already have the volume. And so what they rely on is, if I'm high quality, I can just rely on that volume to keep going and get a diverse patient mix. And so I think that has been such a trend of people caring first about quality, and then they choose, between the two with cost. And so I think that trend has just been a very interesting one that a lot of people don't pay attention to, but it's really going to help when you're trying to help your clients reduce claims costs that are unnecessary and improve quality of care, reduce recovery time after surgeries, things like that. You really want to look at, but you have to have that quality piece.
Yeah. So the app sounds amazing. We should definitely do a deeper dive. We should do kind of a viewer on this. We can see it.
Yeah,
I think it's so important because that speed to care and kind of ease of access, like you said, Lydia. For me, like when we were dealing with my grandfather and also when I had just given birth, they give you a few minutes to make decisions. Like they don't give you, I remember they walked out of my labor and delivery room and they're like, we'll give you a few minutes to decide on like next steps for my health. And my husband was like, so what do you want to do? And I was like, just gave birth.
Yeah.
Don't really know.
Yeah. Yeah.
Because but they did that with my grandfather as well. They gave us a few options. They're like, we'll give you a few minutes to decide. And you're like, okay, medical encyclopedia, Google, anyone, just so to have somewhere that you can trust, or even someone that you could talk to or chat with that's like, hey, tell me what the best, because you're not in your right mind when you're having to make healthcare decisions. You're in a very vulnerable place, which I think is the next hardest piece about healthcare decisions, is like, that you're just probably not in the best frame of mind to be making very large life-changing decisions right then.
And that goes to what you said about like people being a number, and like you kind of lost that human aspect. Like we have to shift more towards the mindset of the humanity portion. And when you're in the hospital, whether it's you or a family member making those big or being asked to make those big decisions, when there are a billion things going through your mind, a loved one obviously is in the hospital for some reasons, it's typically not positive, right? And just to have somewhere that you can go and you can trust who you're going to, and then that person is going to help you make that next decision, not rushed, not rash, but just a wholesome place where you can go and get guidance. That really brings the humanity aspect back to it. And that's what we have to shift our mindsets towards when talking about healthcare.
And unbiased,
Well,
right? Also.
And unbiased.
Yeah, and I think we've been told by this with all of our brokers, because when I created this, I remember I told Gerald, my VP, I want it to be agnostic. I don't want no direct contracts, no direct anything, no affiliations. Your quality score, if you have a problem with it, take it up with CMS. We let CMS, we let Leapfrog, all these accredited sources do their job, but we do the hard work of actually combining all of that information. That in my mind, I was like, if I was a patient, I would not trust any app that put sponsored on a hospital, or like, what the hell, what is this? Why are you pushing a hospital towards me? It's that kind of like deceptiveness that I don't like. And I remember because someone asked like, why don't we do that? And obviously the agnostic part, but I also just said, when you got a good product, you don't have to keep adding in different deceptive ways of getting money. our app is fine on our own, and luckily, like, thank God we don't have to do those kinds of things, but it's important because you don't want any bias. It's someone's life at the end of the day. That's where I draw the line, because if I heard that someone was, pushing my grandma to some hospital just because they would get some sort of like a kickback or something because she went there, oh my God, all hands are being thrown across the room. Someone's gonna have to hold me back. It's gonna be a
Fists come
problem.
out.
No, it's because, like, everyone has that person in their life where if you mess with them, you might as well say a prayer to God. I mean, it's
Mm-hmm.
it's at that point, right? And so I think the agnostic piece, I know from our brokers, they've all said that that's one of the things that they can't find in a lot of places anymore. And so I think it just also just brings them comfort as well. And so the agnostic piece, but also just making sure that it's easy. Like you said, they give you a few minutes to make a decision. That's why we made Care Genius. You can literally just text it really quick to figure out what you want to do, and it'll give you the guidelines. And it also like combines your claims data too, so it knows your history. It's not just going based off of,
Wow.
and it's been a long time of us like creating such a robust system. And so, but I wanted it that way because I don't want any friction, right? I don't want any, I don't want to make it harder on anyone. And so, they only give you a few minutes, which also, just if anyone's watching, you don't have to make a decision that quick. That's just a tactic that they use. They did it when I was at the health system. It's BS, if I'm allowed to say that.
Yeah,
It's,
call
Yes,
it
you
out.
can. This
no,
is called
it is.
captives over cocktails. You can say anything.
It's a way for them, because essentially it's kind of like a negotiation tactic, right?
Hmm.
If you guys have ever seen Shark Tank, Mark Cuban on Shark Tank, he likes to say, like, okay, make a decision now. Like, I'm gonna pull out if you don't make a decision, like, right here, right now. And like, that's a tactic that we all know, where if you feel pressured to do something, like, you're gonna go with whatever either the nurse told you to do, the doctor told you to do. Sometimes the doctor is literally just going based off of the policies that the hospital says. So if the policy that the hospital puts in, or the recommendation that the hospital has, is that we want you to only push this person towards, this doctor that's in our network, right? Because they want to keep that revenue. A lot of times that happens, and a lot of people don't know that. So sometimes your doctor isn't always telling you the full scope, which is unfortunate, but that's where we are in corporate healthcare. And so, again, you don't have to make a decision that quick, but you need someone to give you a lifeline, because it is extremely emotional and it's scary. I think that's the most
Very.
important part. It's scary. So that's our take on
Yeah.
that.
Love that. Well, I know we're running up on time. So is there anything else, Kayla, that you want to share with our audience before we wrap up?
I think, as the benefit season is coming in real hot, we're in Q3 already. So I think that as people are looking to figure out ways, okay, what do we want to do for this benefit season? What are your goals, in terms of reducing claims, in terms of improving access? Captives have been shown to be a very, very good option, especially when you're trying to break out of that mold. We've worked with captives before, and we work with captives now. They have been a really good source for a lot of people when it comes to having that funding decision, or having that funding type that
Mhm.
really gives you the best of both worlds. And I think, two, is think about how you want to facilitate that, right? So you have the captive, but I always say insurance is on the back end, right? That's at the end of after the decision has been made. But think about the front end, right? And so that's where navigation comes in, is okay, before anyone even makes a decision, let's make sure that they're making the right decision. And that's really how you have a robust risk management strategy, so that you don't have to be scared about high cost claims or your employees making a wrong decision. So I think those two combined are a really lethal strategy that, benefits, consultants and also employers should definitely take a look at when they're trying to decide for this next go around what they want to do.
Yeah, breaking out of
That's
fully
great.
insured gives you the ability to partner with someone like the Healthcare Navigator.
Mm-hmm.
You can make better decisions for your employees, and they can make better decisions for themselves by using it. So Awesome. Thank you so much, Kayla.
Kayla, thank you so much for sharing your
Thank
insights.
you.
We appreciate it. It was so valuable. I know that everyone is going to have a great takeaway from today's conversation. So thank you so much for being on.
Thank you guys for having
All
me.
right. Cheers to that. All right. We'll see you next time, guys.
Cheers.